Good
Go on.
evening. Good evening to everyone. I am presenting a case presentation on TAPV patient with COVID. So, brief case summary. Patient was referred to us in a view of CHD obstructed TAPVC. Baby and mother's test positive for COVID. Baby was shifted to the adult COVID ICU along with the pediatric cardiac nurse for the further management of COVID for 10 days, and then was shifted back once the test report was negative. Baby was operated after the test result was negative. Post surgery, baby had feeding issues as the mother was not available. Exclusively breastfeeding was established and then the patient was discharged. So the birth history of the patient was the baby was born of a full-term LHCS with a weight of 2.8 kg. On a periodic follow-up, the baby had reduced weight gain and had difficulty of feeding. So a 2-day echo was advised, wherein the baby was diagnosed for a CHD supracardiac TAPVC and was referred to a hospital for the further management. At the time of admission, the patient was on room air and was active. The vital signs were normal except that the patient had tachypnea with a respiratory rate of 64 breaths per minute. COVID test and MRSA screening test was done for the patient and parents as per the hospital protocol. All preoperative investigations were sent and the surgery was planned for the baby. But the baby's and mother's COVID test report was positive. So the in brief, hospital course of the patient was shifted to the adult COVID ICU for isolation as we do not have a separate pediatric COVID ICU. Initially, the baby was NVM and then was started on formula feeds, and as the mother was home quarantined, the patient was isolated for 10 days and was shifted to PCICU once the test was negative. Post-COVID, all pre-op investigations were repeated for the patient. A CT scan was done for the patient. Post-COVID, the parents were counseled for surgery, wherein the parents were explained regarding all the post-COVID complications that were expected. On the 21st day of hospitalization stay, the patient was operated for TAPVC repair. The patient's post-op stay was less than expected as there were less clinical complications. The patient was started on TPN immediately post-operatively, extubated on post-operative day and started on feeds. Baby was exclusively on breastfeeding at the time of discharge. The baby was discharged after 30 days of hospitalization. So the challenges that we faced were pre-operative challenge. The baby and mother was COVID positive. The counseling was done for the parents as we needed to shift the patient to the COVID ICU. The mother needed to be quarantined. The complication of the patient's condition had to be explained due to the COVID. Then the counseling of healthcare team was done as a nurse, especially for the nurses who were taking care of the COVID baby. Then the management in the COVID ICU, the prevention of infection. Post-operative challenge were the prevention of infection, nutritional requirement of the baby as per needs, lactation issues, and providing psychological support. So the nursing interventions we carried out were first was the counseling. As the patient was COVID positive, it was a panic situation for the parents. The parents were counseled by the consultant and the infection team doctors. The baby was isolated for 10 days in the COVID ICU. The assigned staff, along with the doctor, should daily video conference the parents regarding the patient's condition. Staffing, as we have no separate unit for the pediatric COVID patients. One nurse from the PCICU who had been vaccinated was assigned to take care of the patient. These staffs were all given psychological support. Injection prednisolone was given as a 5-day course for COVID treatment. As a nursing intervention for prevention of infection, all infection care bundles were followed. COVID protocols were followed. All medications and fluid were prepared in the laminar hood so that there is no any further infection to the baby. COVID duty nurse who were posted in who were posted with the baby were not posted in PCICU during this period. Nutrition wise, during the patient's COVID stay, as the mother was not available, baby was on full formula feeding and additional nutritional supplements were added. Post operatively, TPN was immediately started for the patient. Feeds were started on the same day of extubation. Mother was encouraged for breastfeeding of the baby as she had a stigma of being COVID positive. Mother was given counseling for lactation due to insufficient milk. Dietitian reference was given to the mother for her nutrition. So to conclude, it is very important to imply right protocols at right place to provide good counseling and ensure the betterment of the child. Thank you.
Thank you, Fritzy. Very